In this session, we're going to discuss the physician order for scope of treatment in the state of Indiana. As of this recording, there's been some confusion among our staff, and my hope here is to clarify the document, the physician order for scope of treatment. So I have only two primary objectives with this. This hopefully will be fairly short. Number one, to recognize the different types of advanced directives. And then finally, to understand how to use the Indiana Physician Order for Scope of Treatment, or the POST document. So what is an advanced directive? An advanced directive is a written or spoken instructions about a patient's future medical care and treatment. The document can name a person or persons to make healthcare decisions for that patient. The document can also name a person or persons who are not allowed to make healthcare decisions. It's only applicable when the patient is unable to express their own wishes. Anytime the patient has the mental capacity to make decisions, they have that right to do that. So are advanced directives required? The simple answer is no, they are not required. The purpose of the POST is to communicate a patient's wishes to healthcare providers. No one can force a patient to have an advanced directive. So what if they don't have an advanced directive? If they don't have an advanced directive, and if there is no one to speak for the patient, and there is a life-threatening emergency, provide any needed care. This is always erring on the side of the patient. However, Indiana law provides an order of priority for others to speak for the patient if they are present or if you're in communication with them. This order is a court-appointed guardian or representative, a spouse, and there's some qualifications to this. The spouse can speak for the individual unless they are legally separated, unless there is a pending petition for separation, there is a dissolution of annulment, or there is a protective or no contact order. So in these cases, the spouse cannot speak for the patient. The next in order is an adult child, followed by a parent. Next, an adult sibling. After that, a grandparent. After that, an adult grandchild. An adult friend. However, there are some special conditions that apply that I'm not going to go into in this presentation. And then the nearest other adult relative in the next degree of kinship that's not listed above. So it sounds complicated, but chances of getting down too far down this list is usually not a problem. So the types of Indiana advanced directives. First, it's very important for the patient to talk directly to their physician or their family to make their wishes known. There are organ and tissue donation advanced directives. There is the healthcare representative. There are living will declarations or life-prolonging procedures declarations. A psychiatric advanced directive. An out-of-hospital DNR or do not resuscitate declaration. The physician order for scope of treatment, or the POST, and power of attorney. So the history of the POST is this. Very simply, it was passed by the Indiana legislature in May of 2013 and became effective July 1st of 2013. So it's not new, and most EMS personnel have been required to go through training presented by the state. And so, again, it should not be a new thing for you. However, I just wanted to clarify some things. So what is Post. Post is designed for persons with advanced chronic progressive disease, frailty, or terminal conditions. Patients who their physician would expect them to die in the next 12 months. And it's designed to transfer throughout the healthcare system to ensure treatment preferences are honored. So what are some differences between post and some other forms of advanced directives? So first, let's look at the difference between a post and a DNR, or do not resuscitate. A DNR and post have similarities and differences. The variety of DNR forms used throughout the healthcare system has created confusion. The post combines DNR preferences and specific treatment guidelines. So who is required to honor the post? All healthcare providers are legally required to honor the post forms, which includes EMS personnel. If a patient has a post and they possess decision-making capacity, EMS should discuss the post orders with the patient and reaffirm their decisions. A patient can revoke the post at any time and may do so during the EMS call. If you have questions regarding a revocation of a post or whether or not the patient has decision-making capacity or other questions regarding the post, contact medical control for any of those questions. So what if the patient has multiple advanced directives? You need to use the most recent or updated version of their advanced directives. If there's a question regarding the validity, contact the patient's physician or medical control. So what makes a post form valid? A post form does not have to be completely filled out. Sections left empty imply full consent. The requirements to make a post form valid are 4 things: a patient's name and date of birth, Section A should be completed, a signature of the patient or authorized representative, and a physician signature. There are some provider legal protections. Acting in good faith to honor the post orders. Choosing not to honor a post if the provider believes any of the following: the form is invalid, the form has been revoked, the patient or representative have requested alternative treatment, the post orders would be medically inappropriate for the patient, and the post orders conflict with the provider's religious or moral beliefs. So in choosing any of these, you are protected from legal action by Indiana statute. So let's get to looking at the post form. There are several sections of the post form that are clearly laid out. Section A is titled CPR, or cardiopulmonary resuscitation. Section A must be completed. The patient must decide that they either do or do not want resuscitation. And notice the definition at the top of this section. It says the patient has no pulse and is not breathing. If the attempt resuscitation / CPR box is checked, full resuscitative measures should be initiated. This includes intubation, mechanical ventilation, defibrillation, or other measures. Section B of the post form tends to create most of the confusion. So I'm going to look at these backwards as they're listed in reverse order as they're listed here on the post form. For medical interventions, Section B is for medical interventions for a patient who has a pulse and is breathing, or has a pulse and is not breathing. So like I said, we'll look at these in reverse order. Full intervention. The goal for full intervention is to maintain life with all available measures. This includes, but not limited to, intubation, advanced airway interventions, mechanical ventilation, defibrillation, electrical cardioversion, or electrical pacing. With the limited additional interventions section, the goal is to stabilize some sort of medical condition. Comfort measures still apply, as in the first section. The use of IV fluids, cardiac monitor including its functions of defibrillation, pacing, and cardioversion, basic airway management to include manual techniques, oropharyngeal and nasopharyngeal airways, mouth-to-mask ventilation, or bag valve mask ventilation. This section does not include intubation, supraglottic or non-visualized airways, and mechanical ventilation. This section does include transfer to the hospital if necessary. For comfort measures, the goal is to maximize comfort through symptom management. If this is checked, the patient desires only those interventions that allow a natural death while providing comfort. This may include medication, positioning, oxygen, suction, manual treatment of airway obstructions. Section C of the post form and D are not usually of concern to EMS. However, as scopes of practice evolve, they may be in the future. Section C concerns antibiotics, and Section D concerns artificially administered nutrition. And you'll notice below Section D, there is a space for optional additional orders. So this is where the physician or the patient can specify other things that they do or do not want done. So it's important that you look at this section to see if there's anything written there. Section E and Section F deal with the signature and contact information for the patient or the patient's appointed representative. So Section E is for that signature of either the patient or the legally appointed representative. Section F is that contact information for the representative should you need to contact them. Section G is for the physician or other advanced practice provider to document the discussion with the patient and anyone else that was part of that discussion. Section H is for the signature of the physician, the advanced practice nurse, the physician assistant. And there's also a space for any other healthcare professional, such as a social worker, a nurse, or other healthcare professional that may have assisted the patient or the representative in completing the form. Following this healthcare provider assisting the patient, the form must still be reviewed and signed by either a physician, an advanced practice nurse, or a physician assistant. And then finally, Section I simply explains the appointment of the healthcare representative and gives the relevant statutes for that information. And these are the references that I used from the Indiana Department of Health, the Indiana Department of Homeland Security, and then there's other useful references that I've listed here that if you want to find out other information about advanced directives or the post document, you can check these. And if you have any questions, feel free to give me a call, email me, or otherwise contact me, and I'll be happy to answer any questions.